Hi, my name is Joseph Kay, and I'm the acupuncturist at Align Modern Health Lincoln Park location. Today, I'm going to be talking about insomnia and sleep hygiene. I bring more than 35 years of practicing acupuncture to the clinic. In the past, I've had a private practice in the Boston area. I've worked in hospitals, specifically in Beth Israel Deaconess Medical Center in Boston in their comprehensive headache clinic, where I was treating patients with migraines, headaches, and other neurological disorders. That's kind of my specialty. I did acupuncture research with Harvard Medical School, and I even led an acupuncture clinic for the treatment of substance abuse detoxification. One thing I have seen is in my practice is the prevalence of insomnia. In this time of stress, anxiety, challenges, and uncertainty, there's an even greater presence of insomnia. Roughly 50 to 70 million Americans are affected by poor sleep. According to some studies, 30% of adults in the US report that they sleep less than 6 hours each night. Insomnia includes trouble falling asleep, problems sleeping through the night, waking earlier than desired, or waking unrested due to poor sleep quality. Poor sleep is linked to higher body weight, whereas good sleep can improve concentration, productivity, and maximize athletic performance. Poor sleepers have a risk of heart disease and stroke, and since sleep affects glucose metabolism, type 2 diabetes risk is associated with poor sleep. Poor sleep quality is linked to depression. Good sleep improves your immune function, while poor sleep is linked to increased inflammation in the body. Sleep literally affects your overall functioning and well-being. Some of you may be familiar with melatonin. This is a hormone that is naturally produced by the pineal gland in your body. It helps you fall asleep by calming the body before bed. It's called the sleep hormone by many people. It works together with your body's circadian rhythm, which is basically your internal clock, and it helps you to know when it's time to sleep, when it's time to be awake, even the time that it's time to eat. Melatonin also regulates your body temperature, your blood pressure, and the levels of some other hormones in your body. Melatonin levels start to rise in your body when it's dark outside, signaling your body that it's time to sleep. It can reduce dopamine, another hormone that helps you stay awake and alert throughout the day. Stress, smoking, and exposure to too much light at night, including blue light from phones, TVs, computers, and other electronic devices, all suppress the production of melatonin. This suppression of melatonin is the way your body knows it's time to wake up. So by exposing yourself to light late at night, you're literally telling your body to wake up. People who do not make enough melatonin will have trouble sleeping. By eliminating melatonin suppressors, you're on your way to a healthier sleep hygiene. Healthy melatonin levels have been found to support eye health and lower the risk of macular degeneration. The powerful antioxidant properties of melatonin may help stomach ulcers and heartburn, and has even been found to help with tinnitus or ringing in the ears. Many of you may already be familiar with melatonin supplements, and I'm sure some of you are probably taking them right now so that you can sleep. However, supplementation may lead to your body slowing down the natural production of melatonin. Also, melatonin supplements may interact with a variety of medications. For instance, sleep aids or sedatives can be affected. Blood thinners like Coumadin may not work the way that they should. Anticonvulsants or seizure medication to help with epilepsy might not work as well. Blood pressure medication might not work as it's prescribed. Antidepressants may not do their job. Oral contraceptives, diabetes medication, even immunosuppressants like steroids don't work the way that they should once you've introduced melatonin supplementation into your body. It's also suggested that pregnant women and breastfeeding women not use melatonin supplements. So what can you do instead? Acupuncture. Acupuncture is a safe approach to melatonin production. Research presented in the Journal of Neuropsychiatry and Clinical Neuroscience states that acupuncture increases nocturnal melatonin secretions and reduces insomnia and anxiety. In one study mentioned, acupuncture was found to promote increases in melatonin in the pineal gland and the hippocampus. In another study, a 5-week regimen of acupuncture was found to promote significant improvement in markers of sleep quality. It also reduced anxiety and enhanced endogenous melatonin production. The acupuncture used in the study improved several parameters of sleep architecture and continuity, reflecting improvements in both sleep initiation and maintaining sleep throughout the night. Improvements in sleep quality was confirmed by the increase in the amount of time spent in stage 3 or slow wave sleep. This deep sleep is important for memory consolidation and performance. Slow wave sleep is also important for secretion of growth hormones in the body. So basically, acupuncture helps a person get to sleep, to stay asleep, as well as improve the quality of sleep. All of this by boosting the production of melatonin naturally in the body. And boosting melatonin, not only is acupuncture going to help body temperature, blood pressure, and hormone levels, but acupuncture is going to help with all those things associated with quality sleep. Things like lowering the risk of heart disease and stroke, improving concentration and productivity, improving the immune function, and decreasing inflammation in the body. In fact, boosting melatonin levels is yet another example of why acupuncture works to keep your body healthy, in balance, and is effective for treating so many different disorders. As if boosting melatonin levels were not enough to help with sleep, acupuncture can help sleep by relieving pain as well. Also, things like restless leg syndrome can be alleviated. And this might be something that might be keeping you from having a restful night of sleep. Acupuncture can help with stress and anxiety management and allergy relief, as have already been mentioned in previous webinars by my colleagues. It's time to live a better life. It's time to try acupuncture. Okay, this was a quick one, but I am ready for any questions that you might have. Okay, so we do have a Zoom chat here, so please ask your questions. Okay, if you don't want to ask a question right now, one of the things that you can do is set up a free consultation with one of the acupuncturists at Align Modern Health. Okay, and we will be sure to answer all of your questions. Okay. All right, I have one question here. Can you explain a little bit about what acupuncture feels like? Does it hurt? This is a very common question. Okay, the way that I like to describe it is that there is the prick of a needle as it's going in, and it's almost as if you're walking through a garden and there's a rose plant there, and you get pricked by the rose plant. By the thorn there. It's kind of similar to that. Sometimes when the needle is in, you might feel some heat at the area, or you might feel as if there is a little bit of a tingly sensation, okay, but it's not pain. Just depending on the particular point that is being used, you may or may not feel anything at all. Okay? And many times it does depend on the technique of the acupuncturist. And if we know that someone is very sensitive, we have ways of getting around anything really feeling too much for that person. Okay. Can you explain a little bit about is acupuncture covered by insurance? Okay. Here at Align Modern Health, we have a number of people that have Blue Cross Blue Shield as well as Aetna that cover acupuncture, but we also have a team that actually will get in contact with your insurance company and see what there is in the way of coverage. But there's getting to be more and more coverage for acupuncture right now. And it's probably a good idea to look and see if you do have some coverage and enlist our help in having us, look for and get to your company and see if we actually can find benefits for it. Okay. How many locations are at Aligned Modern Health? Which location are you at? Okay. I am actually at the Lincoln Park location. Currently, we have about 15 locations, okay, throughout the city as well as out into the suburbs, but I'm at the Lincoln Park location. Any other questions? How long does it take the effects of acupuncture to work? This really depends on the individual. With some people, you treat them once and it's like the seas have parted and all of a sudden 10 years of problems have gone away. With other people, it takes a few treatments before they notice anything at all. Everybody is very different. And one of the things I always tell a person is that the first treatment itself is really part of the diagnosis, because there's no way of telling until you actually treat that person. But the effects can be almost immediate, or sometimes it takes a few treatments before the person feels a little bit better. Okay. Does Aligned offer herbal supplements? Are there any that could help with insomnia? Yes, there most certainly are herbal supplements that we have at Aligned, and there are many different supplements that will help a person in terms of insomnia. Okay, but we first have to do a diagnosis of that person and just determine the cause of their insomnia from our own perspective in the acupuncture world. Okay, so there's supplements, but there isn't just one supplement that a person would take. It really depends on the individual and their body. Okay. Would you suggest any acupuncture points that someone could use to help with their insomnia? One of the things that you can actually do is you can go to the ear. There's actually about 200 acupuncture points in the ear alone, okay? And you don't have to do any sort of real point location or try to find the exact point. You can really just kind of go to your ears and just massage them a little bit. Or if you have someone else that can do that for you, they can massage their ears, particularly near the top of the ears here, okay? And that can actually help in terms of relaxing your body and preparing you for sleep. Okay. Any other questions? Are there telemedicine options for COVID? Yes, here at Aligned, we do have options for COVID in terms of acupuncture treatment. Not that we're going to be telling you where to put the needles, okay, but we can give you some ideas in terms of, from a Chinese medical standpoint, in terms of making your body feel a little bit better and also helping to kind of boost your immune system a little bit. So yes, there are telemedicine options that we have for COVID here at Aligned, both with the acupuncture and particularly with functional medicine, okay, and I'm sure there's suggestions that the chiropractors can give you as well. All right. Anytime I take a melatonin supplement, I fall asleep quickly, but wake up wide awake in the middle of the night. Do melatonin levels change throughout the night while sleeping? Okay, they can change just like any hormonal changes can occur in the body. It also, if you are starting to take melatonin supplements, as I said before, what can happen is that your body can kind of slow down the overall natural production of melatonin in your body. And if your body sees that you're taking something from the outside, it might slow it down enough that it may not be enough to actually get you through a whole night of sleep. Okay. All right. Let's see. After taking few sessions of acupuncture, can we practice that at home? Oh, that's a nice one. No, not really, okay, because, it's more than just sticking a needle in the body or a push button system. There's a whole system that you have to learn that takes 3 years of schooling, okay? Some people will learn a little bit of acupuncture in a shorter amount of time, but sometimes it's almost like surgery compared to first aid. Okay, so it does take some time. Can you talk a bit about how acupuncture helps with insomnia? I must have missed that part. Well, What I was talking about was the idea of acupuncture being fundamental in terms of really exciting your body to, and it enhances the body to make a more melatonin. Okay, so you get the effects of a melatonin supplement, but without the melatonin supplement coming from the outside, it's endogenous. So what that means is that your body is naturally producing it, so it doesn't have that same perception of your body, you know, where your body's going to slow down the production of it because it's your body that's doing it to begin with. So it really is that the acupuncture is going to help with melatonin, okay, but it also can help in terms of other hormones in the body and just really kind of relaxing your body more so you can sleep and just really get the body to make it through the night. All right, let's see. Can functional medicine help with insomnia too? How does co-treatment work at Aligned Modern Health? All right, functional medicine can most definitely help along with what we're doing with the acupuncture. In fact, it's very common for myself and our functional medicine doctor here, Dr. Gill, and where we kind of trade people back and forth, or we will see the same patient. You know, they might be on certain supplements and we'll have certain tests done. They might find that their cortisol levels are too high, and with the acupuncture, in addition to what they're doing with the functional medicine doctor, we can kind of bring that down a bit. Let's see. Would acupuncture be helpful or effective with children? Yes, actually, you know, acupuncture works very well with children. And, you know, there's actually specialty techniques that are used that will treat children where the needles don't necessarily have to be inserted, where there's a lot of techniques where you can do rubbing along the channels, okay? Or you can use techniques with a device where you're really just kind of touching points. Because the thing is with a child is that their blood and energy move very quickly, so they respond very quickly as well. So the treatments themselves can sometimes take as little as 5 to 10 minutes, but most definitely a child can be treated with acupuncture, okay, and effectively. Any other questions? Let's see. After taking, oh, I already had that one. Okay, any other questions? Let's see, what is this? Is acupuncture advised for any particular health problem, or can it be done by anyone irrespective of any health issues? Okay, well, obviously, if a person needs surgery for something, okay, and it's something where there's been a nerve that's severed or something is going on, an immediate trauma, then they are much better off going to the emergency room or having that surgery. However, there are instances too where a person has a chronic condition where acupuncture can be very helpful, and many times a person might actually be able to forego having surgery at all. But you know, the other thing is that acupuncture can help with pain either before or after surgery. So really, it's a good idea to go in and get some, you know, have a consultation with the acupuncturist, and then maybe working in conjunction with your own medical doctor and just seeing what is the best avenue for you to take. Okay. Let's see. Is acupuncture advised for any? Oh, that is that same question. Okay. Let's see. Any other questions for me? Anyone? Let's see. Okay. Nope. Nope. Already covered that. Okay. I think I've actually. Let's see. I think we're good. Okay. All right. Well, if there are any questions that I haven't answered yet, or you don't want to ask right now, you're still kind of formulating your question, okay, you can always set up a free consultation with me or with any of the other acupuncturists at Aligned. You can also visit our website at alignedmodernhealth.com to connect with a patient coordinator. Okay, and hopefully I will see you at some point in the clinic, or if not me, one of the other acupuncturists. Okay, thanks. Thanks for joining us for this webinar.